rate as other strains, but cases are shooting up.
Over 200,000 daily cases is just shy of a record set for the entirety of this pandemic.
And a significant announcement from the CDC changing course on isolation guidelines. UW Health Chief Quality Officer Dr. Jeff Pothof is back with us. Lots to talk about today.
Good to see you.
Yeah, never a dull moment.
Let's talk about the surging numbers first of all.
Yeah.
How bad is it?
You know, it's not great right now. We are seeing a surge in numbers. Omicron is probably part of that. There's still Delta left over. And what it's really doing is putting a significant strain on hospital capacity. I think, as everyone knows, we're, limiting those non-urgent, non-emergent procedures. We're really trying to spread those staff around. We're changing the hospital venting systems to accommodate all the patients. And despite all those efforts, the circumstances right now here in the state are just stacked against us. And we're worried about what that will mean in a week or two as far as will people be able to access health care if they need it, if things continue on the current trajectory.
The hospital is near capacity, I understand.
I would say it's at capacity. I mean, we have folks that call us that want to send their patient to us because they can't take care of it. And despite our best efforts, we have to say no. And, in the past, if we said no, it was just for a few hours. Nowadays, we just aren't finding that room, same day, sometimes not even the next day.
Have you admitted any patient into the ICU that has been vaccinated?
So I have not admitted a patient to the ICU that's vaccinated. I do know that it happens, but when that happens, there's always an asterisk on that patient, and it's usually someone who's profoundly immunocompromised. We do a lot of transplant care at UW, some pretty high-end chemotherapy for cancers. Those folks, when they got vaccinated, knew that it was kind of a hope that they would actually develop immune response, and for some of them they didn't, and they are at risk almost as if they were unvaccinated.
The CDC's new guidelines shortens the isolation period from 10 days to 5 days if you are not showing any symptoms. And it was driven in part to cut down on staffing shortages. The airline industry was one industry that pushed hard for this. Will it still protect public health to shorten that isolation window?
I think the CDC recommendation, when you look at the pure science of it, I see where they have come from. So the data currently suggests that you're most infectious 2 days before symptoms to 3 days after symptoms. So if you take that and you say, okay, well, 5 days out, you might be okay, that's true. But unlike the 10-day guidance, where most folks have cleared it by 10 days, there are a fair number of people who will not have cleared the virus by day number 5. It's true that they'll have symptoms, but I think the confusion comes from saying asymptomatic. I might say, well, I had a fever and cough, but on day 5, I only have a runny nose. Am I good to go? And if you say yes, you're likely still spreading that virus. So I think it's trickier with the current recommendations. I would like to have seen more emphasis on that testing requirement. If you're 5 days out, you have no symptoms, and you can't make an antigen test positive, I feel pretty good about you being out in public with a mask on. But if you're 5 days out, you think you're good, and you test positive on that antigen test, it's a no-go. You got to wait a little bit longer.
So they're not requiring the test to go back?
They just suggest it, but they're not mandating it.
That's troubling.
A little bit.
So, given the infectiousness of Omicron, do you think people should rethink their New Year's Eve plans this year?
Yeah, I think with Omicron out there, you really have to think about what is your risk. So, on the positive side, if you're fully vaccinated and you're boosted, I think we're going to hear more about fully vaccinated, meaning boosted. And you know that the group that you're gathering with is boosted. And I would add on, and you've all recently tested negative on a rapid test. That's actually pretty low risk. I wouldn't have a problem with folks having a New Year's celebration in that environment. But if you don't know the vaccination status, and some of the folks you're going to gather with are maybe unvaccinated, now you've created an environment where that risk is just too high, and you can't do that.
Do people actually redefine the definition of fully vaccinated to mean three shots?
I think you'll see it. It hasn't happened yet, but I think you're going to see it in the next month or so, that fully vaccinated will mean 2 doses, and if eligible, a booster.
And they're looking at a 4th dose in Israel.
Yeah, Israel's a little bit ahead of the game. I don't know about that yet. I think, we haven't had enough time to understand what's the durability of that booster dose. And with some vaccines, the durability is much better. It's not guaranteed that every 6 months you're going to need a booster. That 3rd dose might last a bit longer, but I'd say for the most part, Israel has been a little bit quicker to the gun on these things. It might not be harmful, but it might be wasting some doses if it's not adding additional protection.
Well, here's to 2022.
Yeah, right.
We need so much more time with you, but luckily we get to talk to Dr. Pothof every week. We are so thankful for you.
Have a happy and safe New Year.
Yeah, Happy New Year.
We'll see you next week.
Thanks, guys.
We'll have a final check of your forecast coming up.